Greetings, my name is Andrea Lopez and I will be presenting my project in which I have worked with my partner Yadiel Ayala. According to the World Health Organization, there are around 86 million blind people in the world. The treatment options for these people are limited, and for most of the cases it is for people who still have an eyeball. However, for those people who have suffered from enucleation, they only have the option of using an orbital implant or covering the affected area. Our goal is to be able to restore vision to these people by merging various ideas, such as the use of an orbital implant and the Argus 2, to create a visual neuroprosthetic that meets their needs. Monash University in Australia and Ottawa-based Ibionics are individually developing neuroprosthetics with higher resolution quality, or visual prosthetics that serve people who have lost their eyeballs. However, both proposals are still under investigation and have not been launched on the market for the consumption and benefit of patients. Here are some examples of types of ocular implants. On the first one, we have a cosmetic shield or scleral shield. It is used in patients who still have their eyes, even if it is retracted, or when a contact lens has no possibility of adaptation. On the second one, we have a double or single ocular prosthesis. It is mainly used in enucleation surgical treatments. The thickness of this prosthesis will depend on the depth of the orbital cavity. And on the last one, we have conformers. They serve to shape the cavity until the final piece is placed. In the visual neuroprosthetic area, we have Argus 2. It is a device that allows some perception of light and movement in patients who have lost their vision due to retinitis pigmentosa. A small electronic device, it is placed on the patient's retina. The patient uses a camera mounted on glasses and a portable video processing unit. The images are captured through the camera, processed, and then sent wirelessly to the implant in the patient's retina. Now we will see some basic eye parts, since in the next slides they will be mentioned. As we all know, there is the iris, pupil, the sclera, that is the white part of the eye, and the conjunctiva, that form the lines, eyelids, and the surface of eye. This is a list of possible materials that we can use in our project. On the first one, we have coral hydroxyapatite, also called HA. It has a cost of $650. And the benefits that we can find is that its porous structure allows fibrovascular growth, significantly reduce the risk of migration, extrusion, and infection, allow a secret attachment to the extraocular muscles. It has a better implant motility, stimulate various artificial eye movements, both fine and fast, and it also gives a more realistic look to the artificial eyes. On the problems that we can find, it can occur a implant exposure, conjunctional thinning, it has a high cost, alveolar secretion, the formation of pyogenic granuloma, implant infection, and persistent pain or discomfort. On the next material, we have synthetic hydroxyapatite. It has a cost of $480, and the benefits, it is cheaper than coral HA, and it is very similar to coralline HA. Therefore, it has a good biocompatibility. And the problems we have that it has a less uniformity and interconnectivity of pores. It is not yet available in the United States. And the problems and complications associated with the synthetic implant are very similar to the coral HA. And the next material we have porous high density polyethylene. It has a cost of 450. It is similar to HA implants. They are usually well tolerated by the orbital soft tissues, and they have a smoother surface than HA implants, allowing easier implantation and potentially less irritation of the conjunctiva after placement. And the problems we have that it has a less uniform size and a more irregular shape. Also, a less biocompatible than HA implants. And surgeons find it difficult that the extraocular muscles can be sutured directly onto the implant. Continuing with the list of materials, we have aluminum oxide. It has a cost of 450. And the benefits, it allows fibrovascular growth similar to the HA implant. It is more biocompatible and soft than HA. It is lighter. It has a uniform structure and excellent port interconnectivity. And it has a less postoperative tissue inflammation than hydroxyapatite implants. The problems encountered with the use of aluminum oxide implants are similar to those seen with HA, but occurs less frequently. And also it has a high cost. On the following material we have polymethylmethacrylate, also called PMMA. It has a cost of 54. On the benefits, it is cheaper. It is ideal for children and elderly people. It has a good biocompatibility with ocular tissues. And the problems, it also do not allow fibrovascular growth. They do not have any device that facilitates the entering of the ocular prosthesis. And in the last material, we have silicone with a cost of 50. On the benefits, it is cheaper and it is ideal for children and elderly people. And the problems we have that do not allow fibrovascular growth. They do not have any device that facilitates the entering of the ocular prosthesis, and there is a risk of extrusion and migration of the implant. And concluding with the list, my partner and I decided to use the aluminum oxide for the project. It is not the cheaper material that we can use, but it also have more benefits than HA and less problems than the HA material. So that's why we decided to choose that material. The manufacturing method used to make an ocular implant is casting. The first step is wax model. Measurements of the anatomical cavity are taken and a wax model is made. Then we have the plaster cast. Once the wax mold is polished and without irregularities, the liquid plaster is prepared, which will serve to create the mold. Then we have the white resin packaging. The acrylic resin to fill the mold is prepared. The white shape. When the resin reaches the optimal level of hardness, it is placed in the plaster mold until it completely occupies it. Then we have the polymerization. The mold is introduced into a pressure vessel filled with water that reaches a very high temperature and pressure. The finish of the white shape and pigmentation. The surface is perfectly polished and painting begins by applying a brush with vegetable colors. Then we have the finish with the transparent resin and the second polymerization. It is covered with a layer of transparent methacrylate by repeating the previous steps. The finishing of the prosthesis and final polishing. And finally, we have the cleaning and the contamination of the prosthesis. Concept of operation. Our device will work as a video camera with the shape of an eyeball that is capable of processing images and sending signal wirelessly to a panel of 175 electrodes located in the visual cortex. This will stimulate it and generate a series of photons that will be able to create an image of a 175 pixels. Another additional improvement that we will place on our neuroprosthetic will be to place electrodes on the ophthalmological branch of the trigeminal nerve, which gives sensation in the eye region, and thus stimulates in case of pain. Since the pain stimulus is not permanent, it will be programmed to turn on when needed, wirelessly. The end users will be people who have suffered an enucleation of the eyeball due to an accident or due to medical interventions that required, such as eye cancer. The stakeholders will be the investors and the people who work in the manufacture of the product, also those ones that work in the clinical area. Some of the constraints that we have found are creating a high-resolution image, and that is in color. In addition, making the device at an affordable price. Also, that by having two groups of different electrodes connect to the same power source, determine if it will have the necessary power to achieve optimal operation at the same. On the other hand, we should determine if the signals of both could at some point cross, avoiding the proper function of it. Some of the future works are to be able to create high-resolution images and also in color. Since the device will work like a video camera, it can be taken in consideration to see if it is possible to record and take images with the neuroprosthetic. These are the references, and thanks for your attention.